Morning and welcome to our policy session. It is, I see this thing I printed, it's a waste. It's the 17th of March. Anyway, welcome to our policy session. And Gary, what's up first?
Yes, so today is Tuesday, April 28th, 2020. We'll do roll call. Chair Bernard.
Here.
Commissioner Savas.
Here.
Commissioner Fisher.
Here.
Commissioner Humberston.
Here.
And Commissioner Schrader will be on shortly, but is not on right at the moment. So with that, we have a very full agenda today, Commissioners. We will get through as much as we can in the first hour, and then we do have time this afternoon to finish any items we don't finish this morning. And Commissioner Schrader has arrived, so she is here as well. We'll start, as always, with Nancy Bush. For a coronavirus update, Nancy is Director of Disaster Management and Incident Commander at the Emergency Operations Center. Go ahead, Nancy.
All right, good morning and thank you. So our numbers for the day, for Oregon, there's 2,354 positives. There's 92 deaths and 48,844 negatives. Clackamas County has 204 positive, which is up 8 from yesterday. We have 6 deaths, 4,703 negatives. Multnomah County has 664 positives, 37 deaths, 11,261 negatives. Washington County has 475 positives, 11 deaths, 7,069 negatives. Statewide, we have 554 that are hospitalized. And some of the new data that we're looking at is going to be released today from OHA. 34% of the Clackamas County cases have recovered. So we obviously still have a lot of recovery going on here in the county for those cases. A couple of other things, according to the Oregonian, Colorado and Nevada have now joined Oregon, California, and Washington in forming a pact for developing a regional framework on opening and getting things back to somewhat normal. So that's fairly new. We don't have any other information about that at this time. Here at Clackamas County, we, over the weekend, received 267 test kits. They were not assembled, so we have to do that. And public health continues to work several outbreaks here in the county with long-term care facilities and in some communities. I know Laura's on today, but we were really glad to see that the North Clackamas Parks districts is opening their restrooms, which is going to help with the houseless and some sanitation issues, and also is pretty, very good for the community in general. One of the big things we have going on today is the behavioral health is launching Go teams today here from the Emergency Operations Center. And those Go teams have 6 individuals for each team. They're county staff and they have various backgrounds. They are mobile and they'll be going out and actually meeting in different facilities that it could be long-term care facilities, other communities that might need some assistance or support with mental health and other psychological first aid type issues. So this is a really big lift on our part. And it's something the county is doing, and it's starting to get a lot of attention, so we're really excited about getting that out. They're trying to minimize the emotional effects of the pandemic in our communities. And we're hoping, right now, of course, they're all English speaking, but we are going to be moving to doing some Go teams that are Spanish speaking as well in the very near future is our goal. And in general, that is my overview today. I know we're going to have other discussions about reopening and recovery later, so I'll leave that for our other topics.
All right, Mr. Chair, Commissioner Savas.
Oh,
Yeah. Thank you, Nancy. I did want to thank you for including the graphs on your situation status reports. The one graph with Clackamas County and the one with the state. In particular, I wanted to point out something. Don't mean to correct you, but I would watch the OHA stats every day. And on Friday, we had 196 cases in Clackamas. On Saturday, it was 201. On Sunday, it was 204. and yesterday it was 204. So we didn't add any in the last couple of days, very, very little actually. So since Friday, we have had 8 cases, but we're trending downwards much faster than Multnomah County and Washington County. And I'm looking at their numbers. The state overall is trending down, but I just want to point that out. Whatever we're doing may not be that it's us per se. When I look at some other national statistics and some other experts around the country speaking, that they're relating a lot of the spread of the COVID thing to transit to some degree and high density metropolitan areas. So we're not quite that, but we certainly are connected to transit, but not as much so as our neighbors. So I did want to point that out, that our numbers are looking really good here in Clackamas.
Yeah, and thank you for pointing that out, because you're right. It was over the weekend. I did misspeak. And yeah, I think our high, I was looking today, was 12 in one day. And then we had several days of 10. And yeah, so far we're starting to trend down at this point. So thank you.
Well, we're doing a good job. But we still got a ways to go.
Mm-hmm.
Any other questions? Well, thank you, Nancy.
All right, thank you.
So Nancy, if you'll stay, and then let's go to Judge Brisbane next. Then Nancy will come back to you and me for some updates on reopenings and recoveries. So commissioners, next, Justice of the Peace, Judge Brisbane is here to give you our final update on the other elected officials in Clackamas County and how they and their operations are impacted due to COVID-19. So we have Judge Brisbane with us today to give you a quick update. Go ahead, Judge Brisbane.
Okay, thank you. Good morning. The Justice Court facility is currently closed to the public, but while we're closed to the public, the clerks can still assist the public by telephone, by mail, and online. For violations, the penalty is, well, for a traffic ticket, the penalty is a fine and there's no jail. Because of this, Justice Court has more flexibility on the timelines for hearing cases since we don't have defendants in custody. The public can continue to enter a plea of no contest or not guilty in response to receiving a new ticket, because tickets continue to be issued, but all the trials are on hold. Initially, there was a large drop, a significant drop in the number of violation citations filed. In the past week, there's been a slight increase in the numbers. The court temporarily stopped taking enforcement action against the public, such as sending cases judgments to collections or asking the Department of Motor Vehicles to issue a notice of a driver's license suspension for not complying with an existing judgment. For existing payment plans, if someone calls in and reports that they lost their job due to COVID or they can't pay this month, their payment can be extended out 60 days. And anytime a monthly payment can be reduced to meet individual needs. For somebody setting up a new payment plan, the first payment doesn't have to be due on that day. It can be set out 30 or 60 days. We're trying to work with the public to make things work for them. Traffic and other violation trials that were set in March, April, May, and June, which is a significant number, have all been moved to July or later. For small claims, the mediations and trials have also been moved to July, and there's a smaller number of those than the traffic trials in our backlog. There's a statewide moratorium on evictions if the reason for the eviction is non-payment of money. This moratorium extends from April 1 for 90 days and was set by a governor's executive order. So no evictions for non-payment can be filed with the court until July 1 or later. But we did have existing non-payment cases in the queue when COVID hit. And so those first appearances on eviction matters that were originally set at the end of March, which is the last time they were being filed with us, have now been moved to July. And our software vendor was in the process of developing virtual court as a system that would be complementary to the software that we are using. They were developing this when COVID hit, and it is now being used on a limited basis in Springfield. So we're exploring the possibility of using virtual court to hear cases in real time with parties and witnesses present on a computer or cell phone screen. But that's for the future. We're in a testing mode with the software vendor at this point. Okay, thank you. That's my update.
You ever thought of drive-through court? Could almost do that in some of those cases.
Yes.
Except for license suspensions.
Yeah, but speeding tickets, stuff like that. Why, did you have one of those, Ken?
Not me. Not recently.
Any questions of the judge?
Not seeing any.
All right, well, thank you very much for your time.
Thank you.
Thank you.
Thank you, Judge Brisbane. All right, if Nancy would come back online. So a few more updates for you commissioners related to COVID-19. I will start. So commissioners, as you know, you temporarily closed most county buildings to the public as of March 18th, 2020. And you have been reviewing that every 2 weeks, and you have been extending that temporary closure of most buildings to the public through Sunday, May 3rd. I am recommending that you extend that an additional 2 weeks, this time until Monday, May 18th. We continue to temporarily close most of our county buildings to the public while still serving the public remotely, as I believe we have done very effectively during these past almost 7 weeks. So commissioners, I am seeking your approval to extend the temporary closure of most county buildings until Monday, May 18th.
So move.
Yep, it looks like we're good there. Do you need a motion?
If you do a motion, please, for the record.
Okay,
Second.
it's been moved and seconded to extend the closure of the buildings to the public to May 18th. Any further discussion?
I have a question.
Question, yes.
I would like to know from Nancy when or what would be the conditions under which you would recommend reopening.
Yeah,
Just
Commissioner, roughly, that's a good question. And the public health advisor and I have been working on that also with Administrator Schmidt. There are some things we're trying to put in place where we are going to be looking at each facility to see what it needs in order to make sure that social distancing can happen, not only with employees, but also with the public. So hopefully within the next 2 weeks, we'll have something that it'll be a little bit more solid that we can answer that question about when we should open and how our buildings would need to look when we do open.
And
So
Gary, I was going to say, and Gary's requiring all the departments to provide a plan by May 18th, right?
Yeah, and I'll talk about that in a moment here, yes.
Okay, so we noticed that it's trending down a little bit at the moment. I'm assuming, correct me if I'm wrong, that that a key point will be that trend downward continues over the next 2 weeks and we don't start seeing it trending the other direction.
That is correct. We're watching that trend very closely, not only for our community, but also for the entire region. And what does that look like since we are connected, of course, to the Portland metropolitan area? So yeah, that's correct. We're watching that. And also where the outbreaks are occurring and what communities they're occurring in.
Do you have a sense of what percentage of victims that are deceased come from which populations approximately?
I know that OHA does have that data. I don't have the data. I've never seen it. But that is something that they're working on determining how they're going to start releasing that information.
Because anecdotally, what we hear is about 50% or so is seniors with health problems and whatnot like that. Do we have any sense that anecdotal information is accurate or not?
I do know just from the data that I have seen, not only in our county, but other counties, that there are several deaths that are occurring within long-term care facilities when there's outbreaks in those particular facilities. So I do know that much, but I can't speak for the entire picture.
Okay, thank you, Nancy.
All right. Any other questions? We have a motion on the floor. All right, why don't you poll the commission?
All right, Commissioner Savas,
Aye.
Commissioner Fisher, Commissioner Schrader,
Aye.
Commissioner Humbertson,
Aye.
Chair Bernard.
Aye, motion carries unanimously. We got a thumbs up from Commissioner Fisher.
Great.
All right, Thank
So commissioners, I will be communicating to employees today that I'm also, for them, extending that they continue to work remotely until May 18th. But the change this time is I'm asking every department to prepare a plan of how they can ensure this health and safety of our employees by allowing them to come back to work if several standards are met, such as being able to ensure 6 feet social distancing protocols, stricter and more stringent cleaning standards for not only public areas but workstations, that we have protocols and staggered schedules in place for those employees that do work. We are not going to bring every employee back to Clackamas County on May 18th, of course not. But departments can now begin to plan how they would allow staggered shifts of some employees coming back into the building around May 18th. So again, the health and safety of our public and our employees is of paramount concern to myself and to you commissioners, but we can slowly start to allow some employees to come back to work after May 18th should these protocols be in place. So that is what we're doing internally for our employees. And that also is similar to the recovery plans that the governor has asked counties to prepare, and that Nancy and our emergency operations staff has prepared. So Nancy, if now could you give a high-level update of the recovery plan draft that I did email to you commissioners. I can't remember if it was yesterday or this weekend, but it's still in draft form. But Nancy, if you could give a high-level overview.
Yeah, so we've had staff, and they had a very small committee that came together to talk about what reopening, recovery, and resilience does look like here for Clackamas County. And I will let you know that we are the first ones, I know, in the region to put this together and to attempt to start putting all of the pieces together. So just at a very high level, we will have a recovery group that we've already started putting together. We've whiteboarded something, not recovery, reopening group. And we've whiteboarded a few things on that. And that particular group will need to obviously come together more quickly to start talking about how do we reopen, the county government and also in general for the county. As you know, the governor has said that the health officer as well as elected officials have to agree and send a plan forward. So that particular group is coming together. We started working on some of the components there. That would dovetail into this larger group or groups that is in the paper that Administrator Schmidt sent out to you. So we would be looking at a policy committee that would give leadership and visioning and values and support. And then from that would be a smaller group that would be leading and providing guidance to the community groups that would come together to talk about recovery and resiliency in the long term. It is important to us that we would be very inclusive in that particular group. And we're talking about things not just about getting businesses up and running, but also equity issues, and how do we want to reframe things as we move forward. There is a good chart in there, an organizational chart that kind of gives you those different levels of what we're looking at and the different types of groups that we are considering. So one of the things that has been helpful for me to get my head around this is it's almost like the whole world has had a 9.0 Cascadia event. The only difference is our infrastructure is intact, which is something that is very useful as we move forward and we try to do recovery and resilience for this particular event. And we have tied everything to Performance Clackamas and the strategic priorities. And that was important to us, and we think probably is important to you as well. And as we move forward, of course, we'll be folding more into the regional group and the state group. Chair Bernard, of course, has been on a lot of calls with the Regional Disaster Preparedness Organization as we try to move a lot of this forward. So that is a high level, and I'm happy to answer questions.
All right.
One of my desires was to either get Dan Holliday or the Sandy Mayor
Stan Pulliam.
on that committee. One of them, I think, rural and urban Mayor would be great, whichever committee, you know, the smaller or the larger, so that they have an opportunity to communicate their concerns. And who's up next?
It's Commissioner Schrader, then Commissioner Fisher, Commissioner Savas, then Commissioner Humbertson.
Okay. Commissioner?
Yeah, Nancy, my question, thank you for all you're doing. My question to you is, and maybe Gary as well, are you planning on any protective gear for our employees when we do open up, even with staggered? Are there going to be requirements to wear masks, gloves? I imagine, you know, and do we have that available, I guess is my question.
Yeah, I can answer part of that, and I'll let Gary answer the rest of it. So here, we've been talking about that. Right now, CDC is not requiring it. I think that we would suggest it, and also talk about, you know, doing some education around PPE, well, the mask, and also sanitation and those types of things. That is my recommendation as we move forward.
And I would, of course, work with departments because each department is different based on the work that employees perform. But I would strongly encourage that we ask all employees who do end up working back in the building to wear some sort of a face covering. It could be the cloth mask or a handkerchief or some sort of covering. But we will do that with employees and departments.
But we still don't have enough to give them other protective gear from our Emergency Operations Center, masks.
So we don't have any. We do have homemade masks that we have been donated, but no, we don't have. We only have like 40 on hand, for example. I mean, that is a conversation we could have if we want to order some that we could have with Administrator Schmidt, but we certainly don't have them here in our stock.
You can buy them at Wilco now.
Yeah.
Well, my concern with the cloth masks is it's generally the person who's wearing it is protecting other people. In other words, that's the assumption.
Right.
So you're not really filtering anything out in a way at all. It stops coughing and a spread, but you have to assume that you're infected with it.
But if you have everyone wearing the mask, and there's some new guidelines out from CDC about how effective a lot of the cloth masks are, which we will bring to the BCC as well. That's probably something that Dr. President, we can have her discuss that too. But if everyone's wearing it, then you are protecting each other.
All right, who was next?
Commissioner Fisher.
And then Paul, then Ken. Okay.
Yes, so a lot of my line of concern is along with Commissioner Schrader in that the bandanas will protect others, not yourself. And so my thought is, if I saw a report that 25% of people could be asymptomatic and be infecting others. I also have seen something that 40%, I don't know if that's true. That was a media report that I saw. But my concern is bringing employees back in closed, confined spaces and not requiring everyone to follow the same protocols is a concern. And quite frankly, I asked in my AOC meeting with Dr. Sharon Myron on there, I said, if everybody wears a mask, are we still able to not do social distancing, be within closer than 6 feet? And really the best thinking is no, even with this protective, everybody wearing a mask, you still need to be 6 feet. So I don't know how we're going to do this safely, honestly. I would love some reassurance about this.
Our doctor will say, Dr. President will let us know. You know, there are a million opinions. And I've talked to Deborah many times about her resident doctor, who tends to be a little on the extreme end while their doctor present, I can't remember the name.
Dr. Vines.
Vines, yes.
Dr. Vines, who's heading up the whole thing, may have a different opinion. So anyway, then it was Paul and then Ken.
Yeah, so Gary, just to clarify, I noticed that the issue that I put on the agenda for today is, I think, this agenda, but I noticed that when I clicked on the link yesterday, that this topic or the graph or the material that Nancy was talking about was included in that. So are we on issues?
We're still on issue. We haven't gotten to your issue yet, Commissioner. This is still an update by me and Nancy, but we sort
Okay,
of
because
segued into it, yeah.
the reason I'm confused is because Nancy's presentation and documents that she's referring to is in my link. So I'm just want to get clarification. But I will say this: I think that we've got to look at not just each sector of the economy and business type, but also, for example, I don't think that if you're a dentist or a patient in the dentist office, it's the same as going to an orthopedic surgeon, for example. There's different types, and I think that's going to be industry driven. And I think we need to rely on a lot of that. So when I look at the structure that Nancy, you included, the 9 pages, I believe, I'm assuming that is more, that's a previous material that was anticipating a Cascadia type event. And this is kind of unique. Maybe I'm wrong there, but I think what's unique about this is that, pardon me, is that we've got to, I think it's got to be tailored for the sectors. I think has to have more business involvement on some of that as far as being represented. And I'm not really sure if that was in the context of opening the county or the context of opening the economy and the private businesses therein. And for example, the schools. So how much of that is internal? How much of that is external? But it seemed very complicated. It seemed to be very, very complicated. And though I read it twice, I get it. I think it's going to be hard with all the titles and so forth, that I think in trying to get the economy and deal with issues, I think we need to be as nimble as possible all the time, always. And I think that the layers there kind of tend to make me think or be concerned about, I saw it says draft on it. I get that. But it just seems to be that it might be too administrative heavy.
So remember, we have a huge issues list, so let's move on. And I'm sure Nancy heard you. Ken.
Yeah, I read the plan. It's very comprehensive, and I like that. But I also recognize that it's, highly bureaucratic, and I don't mean that as an insult, but rather it's what I would expect because we work in a bureaucracy. I would like to make a couple of comments. One is a single page outline of this that would be simple and easy for the general public to understand would be helpful. For those who want to dig deeper into the depth of this, having it online once it's approved with a link to it so that people can see what we're doing, how we're doing it, that I think would be helpful for the general public in terms of public information. I would assume you'd work with our PGA folks on how to do that part of it. But the thing I really wanted to compliment you on is I really liked how you took the recovery support functions and tied them to the performance Clackamas strategy priorities or strategic priorities. So we don't get so lost in what we're doing just to get out of this mess that we forget about what our long-term objectives are and what our principles are as a county commission. So I really wanted to compliment you on that. I thought it was excellent. But some simplification, I think, for the general public would, and quite frankly for us too, would be helpful.
And this is a tri-county effort.
Understood.
Correct?
Well, so this particular paper is actually about Clackamas County and how we move forward. And then there is a piece in there how we would fit into the tri-county.
Yeah.
We are the first ones to come up with this particular white paper.
Mhm.
As far as I know, there's no other county that has done that yet. And they've been asking for our stuff, which we've been providing. But
Yeah, we talked a little bit about this last night. So Paul?
Yeah, just real quick. Let's have a work session on this. I think there's really a lot. I think all the comments that people made are valid, and I think we really need to get our arms around this. And I don't disagree with anything that's been said.
Let's just take another week on the draft, trying to get it clearer and some attempts, and then we'll bring that back either next week or the week after, because the 18th is a way away, but
Well,
as soon as we
I think
can.
it would help. I think it would help staff to have some direction from us. And this is not, as you kind of pointed out, we have limited time. So I don't think we really give Nancy the adequate guidance or concerns. I'm cut mine short, but I have a lot to add, but I'm being respectful of time.
Yeah, well, you can talk offline with her too. The challenge is that we're data driven and we're using the EOC and doctor presence
Mhm.
as well as a regional perspective. So I don't know that, I mean, our input is key to this. It's just, I think what you guys have all said will help Nancy get there. But give her a few days, okay, Nancy?
Yes, yeah,
And
staff,
then why don't we, we could do something similar to this, just and discuss this, or we'll bring it to you and here in the next few days, and then you guys can give us some input on it.
okay,
All right.
thank you.
Thank you. Gary?
Nancy, when you're ready, Nancy, you let me know, and commissioners, I can devote an entire hour of issues to this topic.
Please. Yeah, we need to have a business perspective in there. And I think I can bring some of that.
Okay, thank you.
And then if I may, I want to assure Commissioners Fisher and Schrader and all of you and all those listening, I will not allow employees back into county buildings until I'm guaranteed by the planning that they will do, that will be reviewed by the Emergency Operations Center, Public Health, Risk, and Facilities, that we can ensure the safety of our employees. So if that can be done by May 18th for some employees, we will slowly let some employees back in the building, and if we can't, we won't. So I do want to assure you all, we'll make sure our employees' health and safety is protected as we are all helping to protect the health and safety of the public.
And also, since the majority of the employees can work at home, there is no reason to rush in here when we can do a lot of that work from home. So we can take our time.
I'll encourage employees to continue working remotely as long as necessary.
All right.
Commissioner Fisher, do you have a question on that?
So question, Nancy, I'm really intrigued by the GO teams. I feel like I got a sense of that when I was at the EOC and learned about how we have our liaisons and all of the many different faceted things that we're doing. But what would be the best way for me to get better educated on how it's really operationalized through the EOC?
You know what? I have a write-up on it that I'm happy to send to you that I have from our staff here. And hopefully that'll be helpful. And if you need more, then we can get you some more. Okay.
Also, I might invite you on the call on Thursday night for the RDPO. Have you listened to that yet?
Yeah, I would really like to do that, Jim. If you could include me, that would be great. I promise not to talk. I just like to listen.
Yeah, Caroline, why don't you send an invitation to all the commissioners to listen in on the RDPO? All right, thanks.
Okay, great, thank you. So Commissioner Savas, we sort of segued into what your requested topic was, recovery planning with board engagement. Do you have anything else to add to that?
Well, yeah, I do. And I think we're going to need the time. So I was hoping to take this opportunity to really queue up the discussion or queue up a work session on different aspects coming from different work environments. So for example, I'm a little concerned that that this kind of emergency is going to go as long as it's going to go. We don't have any control over that. That's really controlled by the virus itself and the conditions. So I understand that. So I think that the way we're structured with the EOC and the ordinance that drives that, and I kind of alluded to this last Thursday, I think there's different levels of the emergency, and being this is going to take longer, and maybe the most intense part of the emergency is behind us and we're tapering off, but we still have a lot in front of us. I don't want to diminish how incredibly important the work is that we do, but also if the intensity stays or this level stays, it's got a load on employees and people and citizens. And I think that we have to be sensitive to that amount of pressure, overtime, costs, and everything. So what I'm kind of getting at, for example, is that the board needs to be more engaged. I think that the worst, again, I don't want to diminish, we still have a long road ahead of us, but I think we need to be more engaged in recovery and how we, number one, work within for ourselves through the administrator and so on, is how the county goes back to work and how different sectors and everything that we do, how we normalize. And I really think that recovery plan is not as detailed and structured perhaps as Nancy's, which I don't, I'm fine with. We need to have that as well. But what I'm saying is that we can normalize governance within. For example, other counties that I have talked to, they're pretty well, other than doing a lot of Zoom meetings or video conferencing, they're governing as normal. I think it's time for us to govern back as normal to some degree, and respecting everyone's roles in the emergency. But I think the Zoom meetings are appropriate. I'm not suggesting that we get back in a room together, but we've rolled back a lot of our work. I don't want to get too far behind, and I don't want our staff to be working a lot of unnecessary overtime and stress, because now they're working at home. And a lot of people don't realize that I had a long conversation with a family member of mine over the weekend who is pretty concerned about, the stress. When you're at work, your goal is to go home and leave work at home. Now you're working from home and you're not really able to leave home. You're not able to leave work because work's still there. So we need to recognize that. And as I kind of mentioned in the conversation at the Family Justice Center meeting yesterday, I think we need to have, for example, a hotline for people that have mental handicaps or anything, or disabled, but a hotline for people to just talk out their issues, and that could be a regional line as well. But I think we need to have some capacity to understand that people have a lot on their mind. They're really concerned, and there's no way to express that. There's not the opportunity to drive home from work, or to obviously to socialize, or to go out even to the store, or do anything to take that stress off. So there's just a lot of things, I think, both internally and externally, we need to be cognizant of. And I think it's going to take some time, but I think it's time for us as a governing body to normalize our governing operations and responsibilities.
Well, the ultimate decision on staffing is Gary's.
That's right.
All right.
So can we queue up a conversation, a work session on that? It might be kind of almost one and the same. I think what Nancy's structured proposal, whatever that may be, in full approved form, might be one conversation. But I'm talking about more from a governing and normalization, even with our partners and our other meetings and community meetings, how we normalize that with social distancing taken into account, Zoom meetings and so forth.
I'm still not sure what you're asking. I mean, we are working as a region, the Tri-County region, to have this discussion. I mean, I'm okay with a work session and including that discussion next week if we have time available, Gary or Kevin.
I'll just move during issues. We can just devote the whole discussion to these two.
Okay, let's do that. So Sonia, she's waving.
She's muted.
Oh, thank you. So I just wanted to respond to what Paul was saying and just give my little 2 cents, because that's what we do as commissioners. I don't think we can normalize based on how we used to be the aspects of government. This is truly an opportunity to prioritize what is most important. And through this process, we will see what is the true functions of government and where do we need to be focusing our energies. So I get concerned about, oh, let's get back to normal, because we're not going to have the normal that we had before this, and for quite some time. And one thing about Nancy looking at the plan, it's like, really, we're not going to start this until June? That's a whole month away. And oh my gosh, this is like 3 or more years until we get through this. It's like, oh, but it's the reality that we are in. And I think that how we're approaching this is ever changing. Things evolve so very quickly. For us to have these updates twice a week that we have from Nancy and from Dr. Present, and the governor is pulling together all those teams for the different industries to open up, for us to be engaged in all those conversations and working locally with this framework that's been provided, and for us to be the policy committee for this framework, I think is critical. And I think we just need to be nimble and flexible.
I think that what you see going on across the nation is going to give us a lot of information about the impact of opening in Florida and various places around the country. My gut feeling is we're heading on the downside, but whatever's happening back east will give us a really good feel for what could be the impact. I mean, Easter was a week or two ago, and 2 weeks ago, so we got at least another week to see some of the impact of that. But I don't want to be the guy experimenting. I don't want to be the one.
Yeah,
So,
well, I just want to clarify, when I say normalize governance in a social distancing way, like we're doing with Zoom meetings, is just what it is, just what it says. So, for example, I'll use the Oregon City matter with what happened with the mayor and everything. Had the city council been engaged and working together, Zoom meetings, whatever, that probably wouldn't have happened. Okay, so what I'm saying is that we working together, doing our work together, as we normally do with our workload, somewhat normal, not physically. All I'm saying, we just need to be more engaged in governing.
so I have a question, Gary. Have we set things aside?
And, somewhat, yes. I've asked departments, unless it is related to COVID or urgent, please hold on your policy topic through April and May. Yes.
Okay, I know the STR, we've set that aside, and a number of things. Is there a list that we might go through and prioritize?
Yes.
Well, then let's do something like that for next week. We'll have that list that we can look at and see if there's something we should prioritize and get off our list. Maybe we kick off one of those or two of those a week. Be nice, so we don't get too far behind.
Absolutely. And commissioners, you're not exactly idle. You are very busy. I mean, you have a full day of policy sessions today, and that's handling the most urgent items that couldn't wait. And look, your issues are going 90 minutes to 2 hours every Tuesday. Your business meetings are at least 2 hours every Thursday. So respectfully, you are quite busy. You certainly have plenty to do, just addressing the day-to-day of this emergency. And I will say it is an emergency. And I absolutely agree with Commissioner Savas. We have to pace ourselves, not only commissioners, but staff. I am concerned about burnout by staff, all staff, and especially the leadership teams. And we're all facing that. And this is an ongoing emergency. It's not going away. It's going to be with us for quite a while. So I absolutely agree. We need to all be able to pace ourselves, but there's plenty to do. So yes, Chair, back to your request, we can bring that list to you.
Okay, great.
Mr. Chair, you have Commissioner Fisher and then Commissioner Schrader.
Okay,
Yeah, just a suggestion for efficiency's sake. So Jim, I think you and Martha as chair and vice chair can go through that list before it comes to us and make your recommendations. I think it's good to share it with all of us, but I would really like your talk with the team, strategy team input first.
Yeah, if you share it with us, Gary, then maybe Paul or Sonia or Ken can call me or Martha, and we can talk about prioritizing that list, and then we'll discuss it the next meeting.
Yep, will do.
So Martha was next, right?
Yes.
Okay, Martha. Where'd you go? Oh, I think you hit, Martha, you knocked out your camera and left your mic off.
I got it.
There you go.
Okay. I just want to remind everybody what happened in Philadelphia in 1918. Think about it, because I think there's going to be a peak in the fall.
Yep.
I think there's going to be another surge. And I worry that opening up too soon without some pretty stringent precautions, we're going to be in a world of hurt. The UK right now is finding out that there are children infected with COVID that are getting extremely serious symptoms that aren't quite like how adults are exhibiting it. There's just a lot that's still unknown about this virus. And I think what I'm hearing from Paul is you really want to be more directly involved in the day-to-day decision-making and kind of feel like you're in the loop. Is that right? Is that a good, I think that's what I'm hearing from people. I'm kind of more free flow, so I just go with it. But are our colleagues feeling as if they're just not getting the immediacy of what's going on day to day?
I don't know that we have day-to-day decision-making. Gary probably does, Nancy does, Dr. President does, but I'm not making decisions every day.
I'm not either.
To go.
I'm just wondering if people just aren't feeling in the loop. That's all.
Okay, we need to move on, but Paul.
Yeah, I'm just gonna answer Martha's question. It's not about decision making. It's about giving the direction I think the staff needs. And Gary's comments, I kind of expressed that yesterday and today. We can't burn everyone out, and we got to be ready for the next. If there is a next wave, like Martha's, I think we are going to see a second wave of this. We can't be so burnt out and spent that we're not ready for the next one. So we need to be able to ride this, and we need to be able to adjust the intensity of this. And we still need to be I think we need to be involved, engaged in the direction of that, and get that recovery plan put in place. And it's something that works with all our constituents. So it's broad, but we need to start having that discussion. I'm not, no one's suggesting that we open the doors tomorrow here.
Yeah. All right.
All right. Commissioner Fisher.
Okay.
Hey, I know, Jim, you want to move on, but I think this conversation is really important. And I agree with Paul that we all need to be involved at the policy level. Absolutely. And I appreciate the framework that's been presented to us, which puts us in that position. And I also want to just take this opportunity to say that I really love the reports we get towards the end of each day. They are so thorough. Caroline and Tracy do an excellent job on the notes for strategy and for the Tri-County. If there's ever a question, I'm able to reach out, ask it, and I get it answered. And I don't know what other counties do, but our overall emergency operation report that we get daily is amazing. I read that through and through, and I feel so informed and so a part of this and engaged with the knowledge that we're given. I just had to say thank you for that.
All right. Are we ready? Move on?
Commissioner Humbertson, Mr. Chair.
Okay.
Mine's quick. Again, I'll rely on the judgment of the EOC director and the doctor, and I want to read a headline. Tennessee restaurants reopen as state sees biggest one-day jump in COVID-19 cases. That's all we need to remember.
Yep.
Thank you, Mr. Chairman.
All right, Gary.
All right, we're going to do Laura Zender, and that'll be the last issue for the morning. So any other staff that's online, we'll come back to you in the afternoon. So Laura Zender has 2 issues to discuss with you. We'll start 3 actually. I'm going to add 1. First, we'll talk about Laura is proposing some schedule changes for county parks and the North Clackamas Parks and Recreation District. I emailed you this morning, commissioners. So I am recommending you approve this, and I'm looking for a head nod of your blessing. We don't need a formal vote, but she is asking that we continue to close through the end of May county parks, North Clackamas Parks and Recreation District parks, and the Boones Ferry Marina, except allow marina slip holders on Boones Ferry Marina to put their boats in the water and their reserve slips starting May 15th. And then for North Clackamas Parks and Recreation District, park restrooms will open on May 4th, and there is adequate staff to properly sanitize and maintain those restrooms while maintaining their own safety. So seeking your blessing to go forward on that, but if you had any questions, Laura's here and I to answer them for you. I'm seeing a thumbs up by the chair.
Gary, I'm not finding that email.
Came this morning from me.
Yeah, I did see it. I'm sure we can come back and adjust it. So I'm not, but I was thinking more 2 weeks and then revisit it. I think at some stage, and I've kind of brought this up before about the people that want to go take their boat out in the water and go fishing. I know that we have a couple of those ramps open, but we have some of them that are closed and that are under our authority. So I think that there ought to be some kind of accommodation, especially as the weather gets better. This is you know, people need to have some kind of a release, but we need to do it safely. So if we can open one up in Milwaukee, I think we can safely open one up elsewhere.
Yeah, and Dr. Present is reviewing this recommendation as well as Nancy, and I believe they're supportive. And I don't understand why we wouldn't open the marina in Wilsonville up sooner. I mean, not the marina, the docks. There is no fishing up that way, by the way. Anyway, are we good to go with the plan for now? And
As long as it's adjustable, we can come back in a week or two. But
Okay.
I want to have a discussion about the other boat launch ramps at Barton and elsewhere at some point. Not today, but soon.
Okay.
Commissioner Fisher?
Yeah, I'm just wondering about the bathrooms being open. I think that's something that we really need to do, but I'm hoping we can strategize a less staff intensive process. If there's a way to have disinfectant materials there for people to take their own personal responsibility to disinfect the bathrooms as they use. I just can't, I don't know what the process will be, but it concerns me that our staff is going to be manning these bathrooms to keep them sanitary. So I don't know, Laura, if you want to mention or explain how you're envisioning that.
I don't have, well, we are working on the plan and I don't have all the details, but we do plan on having our staff go to the bathrooms multiple times throughout the day to make sure that they are sanitized and clean. I do know that we do plan on using face masks and gloves and everything that is recommended by the CDC and the county and the governor's office. So we will ensure that our staff are safe as they are cleaning the bathrooms.
Well, I'm just wondering about people being able to take, if we had wipes or something by the entrance of the bathroom and people could take them, and when if they want to sanitize the faucets before they turn them on, or if they want to sanitize, whatever it is, if people can do that themselves, if we provide that level of sanitation.
We can definitely, I can talk about that with Director Archer. We are currently going to be doing that out at the golf course. We're going to have the wipes at the entrance of the porta potty so that you can wipe the handle as you walk in. So we could do something similar to that, but I would need to discuss, and I can get back to you. I need to discuss that with Director Archer and whether we could get those sanitation wipes before Monday, because that's when we're planning on resuming and opening the bathrooms.
Yeah.
Right. Chair, Commissioner Hubbardson.
Yes, Ken.
Respectfully to Commissioner Fisher, but I don't think we can rely on the public to be able to actually do that in the park restrooms, and especially, and I'm reading the reasons why you're opening up the park restrooms and the population that may end up being using them. I think we're going to have to depend on our staff to deal with it. So if we're going to do this, then they have to have the proper PPE to do it safely. I just don't believe we can depend on the public, nor should we under these circumstances.
I do think you should put a sign up and say that, you know, if people don't maintain or keep the the facilities clean, you may close them again, you know.
I agree with that.
Thank you so much for your comments.
All right, Commissioner Savas, Mr. Chair.
Yeah, I just want to add on the bathroom thing. I agree with Commissioner Fisher's comments, but I want to add that we've, you know, for example, I believe at Stringfield Park, we locked the bathrooms, but we put in porta potties, and the same sanitation requirements and needs are there as well. They're no different, other than you've got a porta potty versus a restroom. I mean, I can see that maybe there's more running water, and it's probably more sanitary in the restroom. I'm glad to hear that we're opening them, but the same issues that Commissioner Fisher brought up, I believe are relevant to the porta potties as well.
I mean, the difference, honestly, between the porta potties and the bathrooms is we did have a contractor servicing the porta potties, and we were listening to the directive of Administrator Schmidt and trying to keep everybody possible at home. But we know now that our park maintenance staff are really essential, and we do need to have them out there. So we do need to bring some of them back to start to take care of maintain our parks, as well as clean and sanitize our restrooms.
All right.
So commissioners, this is an operational decision that I'm authorized to make. So I made the decision. I wanted you to be informed, hear your input. I've heard it. We've heard it. If there are any concerns for safety of employees or the public, we'll revisit this decision and let you know. But we're going to go forward on these.
Can we announce it?
Well, I'll let Laura and her team get the public notice out, although I guess anyone listening right now has heard it. So Laura, do you want commissioners to wait, or let's spread the word?
No, yeah, they can go ahead and announce it. We are actually updating the website to reflect that, both NCPRD's website and the county website. That's happening today. So feel free to put the word out there.
Thank you, Laura.
All right.
You're
Thanks.
welcome.
Laura, let's do the second one first. Can you give a quick update on the Hoodland Women's Club MOU, which is on your agenda for this Thursday, commissioners?
Yeah, so regarding the MOU, we have a MOU between the county and the Hoodland Women's Club, which is going to be on the consent agenda this week. And so, but I just want to give you a little background for those commissioners who aren't fully up to speed on all of this. But so by way of background, we have a property that's approximately 4 acres in size, and for many years it was managed by county parks, with the site serving the local community within the Mount Hood corridor. And the Dorman Center was run on the site and run by the Hoodlands Women's Club, and provided adult and community recreation services, senior activities, and the community garden. The center was closed down in 2012 by county parks following an engineering report that showed that it was not structurally sound, and it was not feasible at the time, or even now, to repair the building. It would have been too expensive. So it was ultimately demolished, I believe it was 2017, but I'm not 100% certain on the exact date. The Women's Club led several efforts to raise funds to build a new community center, which would have cost about $2 million. Those efforts ultimately fell through. So then in 2018, it was suggested that the county consider transferring this asset to the community if the Hoodlands Women's Club and community could successfully form and pass a local parks district. So then following that meeting, we had a meeting with the BCC, and we set up an MOU that was approved in February of 2018 between the county and the Women's Club that would defer us surplusing the property until November of 2020 to give the community the time to, again, do the district formation of a park and gain the support that they would need to pass that parks district. And since the MOU was signed, the women's group has been working with the SDAO, a local attorney, and the assessor's office to move through the steps. Then in March, the Women's Club reached out to express their concern that the COVID-19 pandemic could delay them meeting the timelines to form that parks district. So what we're doing is doing an extension through May of 2020 to allow them to put it on the ballot in May and potentially form that parks district.
You mean 21?
Sorry, yeah, 2021, May of 2021, so that they'll have the time to gain the support to pass that parks district. So that's will be on the agenda again, consent agenda on Thursday.
Okay. Any questions? All right. Great.
Okay, and then one more before we go to the policy session. Laura has presented to you by email a business support plan proposal that she had already discussed with you at issues a week or so ago. She has now put it into writing, a more formal plan. So we don't have a lot of time, but Laura, if you'd like to give a really high-level overview. This is just to get your commissioners, just want to hear that you're okay with this approach or not. We're not here to have a full discussion, not a 30-minute talk, please. Go ahead.
Okay, I'll try to go quick. So again, you may recall that I did attend issues a couple of weeks ago, And we have since refined what we presented and developed the one-page document. You should have received that. I just want to give a quick shout out to our BCS Economic Development team, Cindy Moore, John Lagarza, Karina Copeland, and then Sarah leading that group. So what we want to do with this plan is address some of the immediate economic and social challenges that the COVID-19 crisis presents. We want to partner with our key stakeholders to develop a plan which again helps the business community through these difficult times. And ultimately BCS, our team is proposing to adopt these programs by pivoting our focus from our regular programming to specifically tailored COVID-19 responses. So we have developed a 4-part plan, and I'll try to go through it real quickly. The first is the mapping solution. And this is really exciting. We've partnered with Technology Services, so a shout out to the GIS team. They've done an amazing job. We've developed a public-facing mapping solution that will create a one-stop central business outreach center for our businesses. The website allows the county to leverage our experience and resources to help businesses market and advertise their businesses. And the businesses will be able to self-register on the website, so they can go in and put their name, their hours, their location, whether they do pickup, delivery, all of those types of things. So it helps the businesses in that way. And then the customer, if you're looking for an open business, on the flip side, you can go put in your address and you can look at a radius around where you live to see what's open. So we really believe that that will enhance support for businesses throughout our community. The go live date for that is May 4th. So it's already underway and we are working on getting that so live May 4th. So we probably need to work with PGA to get some social media out there with regards to this, but really excited to announce that. Do you have any questions on that piece? No? Good to go? Okay. The second, good?
Right.
Okay, go ahead.
Excellent.
Okay. So part 2 is the grant loan program, and that's the $300,000. And so this is where we're working with Micro Enterprise Solutions of Oregon, that's MISO, and they will provide economic and social assistance to the affected businesses that are affected by COVID-19. They will assist vulnerable businesses impacted by COVID-19 by providing much needed cash as well as technical support to develop the new talents and skills that will be needed to make them more marketable. So how will we do this? So we're going to provide approximately 65 $1,500 grants. So those are forgivable, not loans, but grants. We're also going to be providing micro loans, which MISO has access to other funds, and so we will provide $100,000, and they can do it like a 3-to-1 match. And again, I talked about the criteria last time, but I do want to reiterate that because it's important. We are going to be looking at businesses in the unincorporated area that can demonstrate having experienced a significant loss due to COVID-19. They have to have 10 or fewer employees. So we're definitely targeting the very small businesses that we believe have fallen through the cracks and not received some of the funding that has come in from the federal government. They have to have a gross sales 1 million or less, 80% of the average median income or less, minority owned or including women and vets. And we have a preference for child care providers. The other really important thing that I'm really excited about is that the MISO personnel are going to be in Clackamas County, and they will have a presence for up to a year, and we hope that goes on much longer. And they're going to be providing technical assistance to 35 to 45 Clackamas County businesses. And again, we're going to be targeting the prosperity zones and those low-income regions of the county and those most impacted by COVID-19. So the timeline on that, just so you're aware, is that we are right now finalizing the sub-recipient grant agreement. That our plan is to have that in front of Finance and County Council next week and get it approved. It'll go on the consent agenda on May 14th, and we plan to announce and publicize the program May 25th is our target date. Any
All right.
questions on that piece?
We need to move through this quickly, please. Paul first, I guess.
Yeah, Laura, I'd love to see any other criteria, not now, but if you just send me any other criteria, because this will be subscribed to pretty quickly. It'll be oversubscribed in a matter of minutes.
Yeah.
And I just want to, I like a lot of what you said. I would certainly want to know, you know, for example, that there's some indicator or criteria that businesses that are most likely to succeed and survive are, you know, rise to the top versus maybe ones that are, you know, maybe in more dire circumstances, and they're not going to make it, so to speak. I know that's a tough call. I wouldn't want to be the person making the decision. I'm not asking to be the person to make the decision, but I think that we got to make sure that we're setting people up for success.
The great thing about what we're doing is MISO has experience. They've already done this program in other areas of the Portland metro area, and they do have a great success record with what they do. And that's partly why we wanted to partner with them. And we will definitely be looking at assisting those businesses that have a better chance of survival. And quite frankly, some of the businesses are probably have already gone under. So by fact that we've waited a little bit, we've already eliminated some of those businesses that haven't made it to date, unfortunately.
All right, any other questions?
So then I won't, part 3 is just a partnership with Clackamas Community College. It's $100,000. And we don't have a lot of details on that, so I'm not going to get into that other than just to say that we're going to provide grant funding to assist the unemployed low-income wage earners in the county, and we'll be partnering with the Clackamas Community College. Again, we actually have a meeting with them later today, and so I don't have a lot of details to share on that. And then the last piece is the $100,000, and that really is exactly what Nancy was talking about. It's to support that plan that she talked about. And we're going to be partnering with H3S, DTD, and the EOC and Nancy Bush to do this. It's a long-term 18-month plan that we're talking about. So again, I won't get into a lot of the details, but and I don't even think the $100,000 will cover what we're going to need to do that entire plan. But we do plan to start and get that kicked off and use our lottery dollars to help with that. So with that, I'm happy to answer any more questions that you might have.
All I have is just one comment, Laura. I would say that from what I've heard from small businesses is getting their hands on PPE. You know, if they're going to ramp up, and we knowing what the governor's framework is for reopening, anything we can do to help them with supply chain, you know, and I don't know if any of those dollars in any of those categories can help them, but I think if we can help them meet those needs and meet those requirements, that's going to set them up for success. If they can't open because they don't have PPE, then they're stuck. Everyone's stuck. So I think we got to be a little bit more responsive in that regard to make sure we're nailing down PPE and not at the detriment of the frontline workers, of course, but.
Okay, well, I definitely good comment, and we will consider that and see if there's a way that we can work and figure out what the supply chain on that.
All right, now they can go to Wilco and buy them.
Yeah. Commissioner Fisher?
Yeah.
Yeah, I understand that we're diverting some of our previous activities like the land bank, but I'm concerned when you say using lottery dollars and the complete crash of lottery dollars right now. I'm just curious about how we're paying for this plan.
So we had a significant amount of cash in lottery dollars that we had set aside for the Land Bank Authority. So that is where the money is to pay for all of this. So we have the cash in hand. I am closely watching the lottery. I've already been in contact with the state, and I'm being told that those dollars are not going to be diverted, that we should be okay. But, you know, I take that with a grain of salt. So I will continue to reach out to the state, and if I hear anything different than like that we're not going to receive dollars, I will let the board know.
All right, we're taking a 5-minute break.
Well, wait, so Laura's going to go forward on this. I
Yes.
heard no concerns or objections, so she's going to go forward on these plans. Thank you, Laura.
Thank
so
you.
yes, 5-minute break, and then we'll go to our 11 a.m. policy session at 11:15. So 5
Okay,
minutes.
thanks. All right. Oh, Gary's not back. Oh, there he is.
Sorry, yeah, all right.
All right, so waiting for Martha.
Kevin, if you bring Jodi into the room, please.
Yeah, so we're getting an error, so I'm just gonna allow them to talk. That'll solve that.
Okay.
Jodi and Brian, can you hear us?
Yes, hi, Kevin.
Yes, we can hear you.
Okay, so yeah, it's not letting me bring you over to see you, but we can hear you.
Okay. Wonderful.
All right. So are you ready, Chair?
Yes.
Okay. So Commissioners, this is your first policy session of today. County Internal Audit Update. We have Jodi Cochran, Chief Audit Executive, and Brian Nava, County Treasurer, to present. You have 30 minutes. All commissioners are present. Go ahead, Jodi and Brian.
Good morning, and thank you very much again. For the record, my name is Jodi Cochran. I am the county's Chief Audit Executive. I am the county's second internal auditor. Brian Nava was our first, appointed in 2015. So really excited to be following in his footsteps and appreciate the opportunity to continue to develop this function. Speaks highly to the board that this function was developed and is supported. So thank you very much. Given the state of emergency that we're in right now, I really wanted to take a few moments just to say thank you for your leadership and to recognize some extraordinary work that is being done in the county by some of our groups, in particular EOC, TS, HR, Finance, PGA, County Administration, H3S, really all of our staff members doing all that they can to continue to serve the county. I'm just really, really proud and excited to be a part of this team. So thank you to them and thank you to you. That said, appreciate that your time is very valuable. Thank you for the time today. We are going to be real quick. Want to give a high-level overview of internal audit and the status of a few things specifically related to Clackamas County. It's going to be, like I said, kind of a broad, quick discussion. Know that you're busy. If you wouldn't mind holding your questions until the end, I promise that I will give at least 15 minutes, if not more, to answer any questions that you might have. Today, there isn't an ask. It's more of information and preparation for some additional presentations that are coming in a couple of weeks. So first of all, just wanted to give a high-level definition of what internal audit is. Internal audit is an independent function designed to add value and help an organization achieve its mission by providing a structured, focused methodology to evaluating and improving an organization's governance, risk management, and control activities. The county's internal audit function relies on some professional standards to guide its work, and we adhere to the Institute of Internal Auditors international standards for the professional practice of internal auditing. IA also has a core value statement and code of ethics. Together, those create what we refer to as the Red Book, and those are the standards that guide the work that I do. Internal audit provides a much broader scope of services than the external auditors. So for the county, we contract with our external auditors to provide an audit of our financial statements on an annual basis. Internal audit services really are services that are available to not only address financial issues that are impacting the county, but also operational, compliance, regulatory, performance, cultural, really a very broad scope for a resource that is designed to be in-house and available. In providing those services, we kind of bucket them into three categories: assurance services, which are your traditional services, consulting services, and investigative services. Assurance services, like I said, are those traditional services with a historical look back. Did we do what we said we were going to do? Did it have the impact that we thought it was going to have? Very retrospective, sometimes maybe reactionary to a particular event or concern that has arisen. Those assurance services result in a formal audit that includes not only recommendations, but also management's responses to those recommendations. And those reports are then published on our public-facing website. And those audit recommendations are followed up on and reviewed as far as those management responses to make sure that we're holding ourselves accountable to those actions that we identified as beneficiary and as necessary to improve our operations. And it really supports the county's efforts to be accountable and transparent. Consulting activities are really designed around daily support and engagement. They include such things as counsel, advice, facilitation, training, participation in management activities, management workforce, and work groups, designing and addressing those policies and procedures that are forward-looking. Really bringing with that a risk lens and a process improvement lens so that when we design activities, we design processes, policies, we put them in place, we actually end up doing what we want to do, and we actually accomplish what we want to accomplish, or at least we give ourselves that much more of a leg up in achieving those things. Consulting activities are very much a catalyst and a collaborative to a well-informed decision-making process at all levels within the county. The investigative services are, again, an independent service, but they are focused on addressing and responding to those reports of fraud, waste, and abuse within the county that come through our county hotline. And the internal audit function is responsible for managing that process. We contract with a third-party provider, Ethics Point, to actually administer the confidential hotline. In order to provide all of those services in an independent and objective nature, internal audit is designed specifically not to have operational authority. In order to provide the independent assurance and support, we do not participate in decision making or in policy design. Our main goal is to provide the county with independent assurance, advice, and recommendations towards the best way to achieve the county's mission. And we're focused on the county mission, not a mission of a particular department or program. We are neutral when it comes to that. We're not supporting one particular individual or goal, but rather the county's mission and the county's strategic goals. We're also independent and neutral in that we serve to evaluate and champion the achievement of the residents' expectation of their good government. And again, hope to be a catalyst towards that transparency and that board's goal of being, of promoting good government. The value of internal audit is really dependent upon its independence and its objectivity. One of the things that the county has in place that ensures that independence, or at least enhances that independence, is the dual reporting structure that we have. So on a daily basis, I administratively report to our elected county treasurer, Brian, and functionally I report then to an internal audit oversight committee. And that oversight committee is comprised of Chair Bernard, County Commissioner Schmidt, County Counsel Stephen Madcore, and County Treasurer Brian Nava. That dual reporting structure allows unlimited access and unrestricted access to all things Clackamas County and helps remove barriers that may threaten my objectivity or my ability to provide those services. In looking at the current structure and in bringing an eye of improvement and continual development of this function, I've identified 3 key governance opportunities that I'd like to come back to you in the next weeks or two to discuss and suggest that we take these next steps. Those 3 opportunities for governance improvements include establishing the internal audit function within county code, looks at restructuring that internal audit oversight committee to involve public membership, and to also then revisit and revise the governing charters of both the internal audit function and the internal audit oversight committee to better reflect updated standards that have been issued by the Institute of Internal Auditors. So Kevin, I think I'm going to go ahead and share my screen now if I can. Is that a possibility since you can't see me?
Well, since I can't see you, I can
We
do
can't
that.
do that.
So I'm going to go to Exhibit A for you.
Fabulous, fabulous. And just real briefly, just so that you guys have this in front of you, was included in your packet. There were 3 exhibits that I included in the prep material. These items will be published on the public-facing website and will be maintained on a regular basis to provide, again, that transparency. The first exhibit, Exhibit A, speaks to the activity that's happened up to this point, the audit reports that have been issued and the audit recommendations that have been made. To date, 7 internal audit reports have been issued, resulting in 80 internal audit recommendations. Of those 80 recommendations, 40 recommendations have already been closed or resolved through activities and actions that the county and management has taken. The reports addressed such departments within the county and functions within in the county as Justice Court, Tourism, TDT, Finance, H3S, HR. The ones that are still outstanding primarily are recommendations that were made most recently in 2018 and relate to recent reports. The majority of the ones that have been resolved were resolved much earlier than that. Kevin, if you want to go ahead to Exhibit B. Exhibit B is speaking to the audit engagements that are planned for this year, for 2020. As part of an allocation of my limited resources, standards require that we look at risks within the county and try to address the highest risk as well as those items that best support strategic goals and missions of the county. So given that, and as a result of the risk assessment that was done this last year, 3 engagements have been identified for 2020. Metro Housing Bond, again, looking at the readiness of the county to utilize those funds. This supports the county's, the board's strategic mission of increasing affordable housing and limiting houselessness or reducing houselessness. The second audit that we're looking at, or engagement that we're looking at conducting, deals with contract administration of human services service contracts. In particular, contract administration of these particular services really speaks to how well we are managing our resources and meeting that additional board initiative of workforce readiness. And then the third item that is going to be a focus of attention, which actually is kind of in the middle and if not wrapping up within the next week or so, is the update of the county financial condition report. That is the 2018 report is online now, and this is an update to that report. This financial condition review will take a look at not only a 11-year, 10-year trend, but we're going to go ahead and extend it to a 13-year trend analysis that will allow us to take a look at not only what the county is experiencing to date as of the 2019 CAFR, but also what are the trends and how are we adjusting and responding over a course of time. This information will help support not only budget and transparent budgeting, but also the questions and concerns, conversations that will be had around building a courthouse. Again, looking at the board's strategic initiatives and goals. So if we want to take a look at the third exhibit, Kevin, thank you. So this last exhibit is giving a to-date review of the hotline activity that has occurred since it was established. Since it was established, 117 calls have come in. Of those, we're averaging about 18 a year over the last 4 years. The activity that occurred during the initial period of the hotline's existence was very minimal, and once the internal auditor position was established, those calls did increase. We are looking at lower activity and lower ability to respond to reports because of the staffing and how we approach the investigative resources. But like I said, we are increasing those. We're fielding about 18 reports a year. Those reports come in written, phone, or in person, They primarily right now are focused at allowing the employees access to that hotline, but we do receive reports from resident members of the county as well. It's a multi-cooperation effort when we take a look at investigating these reports. We work closely with HR, county council, county administration, and of course the departments that may be impacted by the reports to evaluate and issue a result of those investigations. What we found over the course of this existence is that the biggest reports topic has been the misuse of county assets or services. That's primarily the one that's most reported. So really that was what I wanted to present, is those three areas. Kevin, I think if you want to go back to gallery view, thank you so much. Quick overview of the status of past reports and audit recommendations, what we're planning for this 2020 engagement year, and really the status of the hotline. Again, I want to say thank you so much for your time, for your engagement, and your support of the internal audit function. Really, really excited about that function here within Clackamas County. Yeah, it says a lot about the decision to create this function and your continued support, and the transparency, the accountability, the good government. I really value Clackamas County. I value the team, and I'm proud to be a part of it. As a resident of Clackamas County, it warms my heart to be a part of this team.
All right, any questions?
Commissioner Savas, Mr. Chair.
Okay,
Yeah, Jodi, thank you for the presentation. Great job. Really, I know we talked about this before. But I know that you've got a number of areas you identified, and I think the attachment that speaks to the high risk areas or departments. And certainly, with only you being the only internal independent auditor we have, bolstering that department with an added auditor would probably help accomplish more, because I'm just kind of concerned that we're really not necessarily keeping pace as things come up. I also really appreciate you bringing up the Metro Housing Bond. Not per se that that's got any issues at all, but as time goes on and those dollars are spent, there's a certain amount of responsibility we have to the taxpayers, and being a kind of a regional kind of a model, that'll be a little bit challenging, but at least there's some definition around that. So having said that, those measures sometimes, I think when they lack detail, probably make it more problematic to kind of really audit and ensure that, things are followed through on, or we're getting our fair share, or they're going as the voters directed, and so on. The one thing I did want to just have you expand on for anyone that's watching or listening, could you talk about Ethics Point a little bit and let people know that anyone, public or internal, can report to the Treasurer's Office on Ethics Point if they know of something or hear of something, just to kind of give a full view of how transparent we are.
So absolutely, thank you, Commissioner Savas. I appreciate the comments. And before I get to the hotline, I do want to just speak to your first comment real fast about the identification of an engagement. You're absolutely correct. Does not mean that there has been a problem that has been identified or a specific concern. An engagement is selected primarily based on its level of risk, and risk really being just the inherent situation and environment that we're in at the moment, that it would be most beneficial to take a look at that and to help mitigate any potential impact that the county might face based off of something that was unexpected. But again, these audits are not being conducted because there is a problem that has been identified, more of anticipation of being able to mitigate and get ahead of things. So yes, the hotline really is an opportunity for the county to be able to hold itself accountable, for us to be as transparent as we can be in addressing misuse of funds or misuse of assets, It serves in a lot of ways as being that vehicle for a confidential conversation or raising of the hand if someone may or may not feel comfortable bringing that to their management or to county administration. We strive real hard to protect the confidentiality of all of the reports, and we address each one of those with a great deal of professionalism and evaluate the sensitivity and the scope of those calls prior to making any sort of investigative decisions about to the extent. But we are very aware of the confidentiality, and keeping that and encouraging that, I think, also encourages people to feel comfortable to make those reports. Not only are we taking a look at individual reports and the validity and the results of those reports, there's a lot of information that comes from the hotline that helps us assist in developing processes and procedures going forward that are more effective controls, that are more efficient use of resources, that maybe indicate that there's a general need for training and education. And so we really do look at that hotline as having many benefits, not only providing an opportunity for someone to raise their hand and have a voice, an opportunity for us to correct something that may be going sideways or in a direction that we would not want it to go as a county, but also as an opportunity for us to recognize opportunities for improvement and put those in place.
Okay, anybody else?
Commissioner Humberson.
You know, sorry, right before Commissioner Humberson talks, just to build upon that too, the Association of Certified Fraud Examiners, which is a global organization, puts out a report to the nations every other year, and consistently every year, the #1 way to identify fraud in any governmental organization is to have a hotline and where you can remain anonymous when you do reporting. That's been, at least for the last 8 years, I can recall, that's been on there. So this is really a tip of the cap to the commission for continuing to fund this hotline, which is not very expensive. And the fact that it goes to a third party gives us another layer of protection. So when people report confidentially, they know that they would have to go through that added layer to get that information. And I've worked with, Jodi and I have worked with County Council MadCorps, as well as just getting some friendly mentoring advice from John Foote about what that would look like if somebody tried to break that level of confidentiality. And the reality is, because you can report confidential and remain confidential, the code that they get, it would be nearly impossible for us to get to the other end of it on who actually reported it if they chose to remain confidential. So really a tip of the cap again to the commission and the board for that, because I think if we're going to be building trust with good government, something like this is important to this organization. So yeah, sorry about that, Commissioner. Since you can't see me, I just want to jump in and make that point before I jumped in. Thank you.
All right, Ken.
Yeah, could we go back to the last slide that you presented? I have a question.
Commissioner Hubbardson, is that the county hotline slide?
Yes. So I'm looking at that and I'm thinking in terms of the general public's not always having great trust in government, unfortunately. And I see 117 reports that you have received. What I was interested in is how many of those reports turned out to be valid, and in two categories. One, of course, would be fraudulent, somebody knowingly doing something wrong, and the other inadvertent, if you happen to have that information available.
And I appreciate that, Commissioner. And yes, I would like to be able to say that I have that information real handy and available to respond. Due to our resource level and our tracking capability at this point, that's not a very quick number to provide you. I certainly can do some work in establishing that information, and we've started to develop a different tracking system and an opportunity to follow up on the resolution of all of these. At this point, and Brian, please jump in, I really feel like an answer right now would be very anecdotal. But I do also want to point out that right now, the hotline is marketed and primarily used for employees. That is another opportunity that does exist. that we would like to pursue going forward is being able to provide a little bit more of a exposure for that. Again, all of these things though, and managing and utilizing the resources and system are dependent upon how well we can follow up on the reports that we get.
Well, my perspective on this is that, if you have one or two actual fraudulent issues there out of 117 calls, that's pretty low level of fraud, and that speaks well of the overall culture of the organization. A couple of mistakes that somebody might make inadvertently, likewise. But if you have a high percentage, then that suggests that there's some work to be done in the culture of the organization. I'd like to get that information. I don't need it in a hurry, but I would appreciate it.
Yeah, and let me jump in there real quick, Jodi. Yeah, and I agree. That's one thing we're putting together. We're looking at the Secretary of State does an annual report. Their audit division does one, as well as some of the other counties. So we actually, Jodi and myself pioneered a kind of regional fraud hotline team consisting of Multnomah County, Washington County, Metro, Jackson County, and a couple others to try and figure out what's the best way to portray that information. Because the biggest complication we kind of get in is that you're absolutely right. The actual quote unquote fraud substantiated cases is low, but there are usually elements of any call where it's partially substantiated, or at least there's information in there that was missing. So that's where we're trying to figure out what's the best way to say, well, there's no fraud here, but there are some elements of improvement, and still portray that to the county to show where those 117 calls are going. So that is definitely a work in process, and hopefully to get to something that's a little bit more standard, so that the public in any element can be familiar with that information.
Let me be clear about one thing. I'm not asking for specifics of any particular event or circumstance, but just the generalized statistics.
So out of 100, you've had 3 cases. You look at them all though, right?
Absolutely, absolutely.
Okay.
We review and evaluate every single one, and again, the information is there. The system is designed; it's not quite easily mineable, and so it takes there's quite a bit of narrative, quite a bit of research involved, and that is one piece that I think is definitely, commissioners, very important to be able to add to this report and this information that we want to put out on the internet.
All right, any other questions? Well, thank you, Jodi and Brian. Great report. Appreciate your work.
Thank you very much, commissioners. I really, really do appreciate your time. And like I said, leadership during this time is very inspiring and much appreciated.
Thank you. Gary.
So that is the end of our morning session. Commissioners, I propose that at 1:30 when you reconvene, we resume with the issues list to get through those, and then go to the policy sessions after that. So if you agree, that will be our plan starting at 1:30 p.m. today.
All right, see you at 1:30.
All right.
Thank you all.